February is American Heart Month, a time for people to focus on their cardiovascular health. According to the CDC, heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 34 seconds from cardiovascular disease in this country. And joining me now is Dr. Sam Mehta, a cardiologist with Denver Heart. Good to see you. Thanks for joining us today.
Thanks, Michelle.
Okay, Dr. Mehta, I just shared some startling statistics about heart disease in this country. Have we seen an increase in heart disease in recent years?
Yeah, it seems that we've had an uptake in the years around COVID, and it's most likely not directly related to COVID, but the adoption of a lot less heart-healthy lifestyles we've seen.
So who is most at risk of heart disease?
So people with a family history of heart disease, therefore have a genetic predisposition. Patients with diabetes, patients who smoke, patients with high blood pressure would be kind of our big four classes of people.
So what can be done to help with reducing the risk of it?
So for those who have untoward lifestyle habits, so as eating unhealthy, it's important to eat healthy, it's important to stop smoking. The other thing most people don't realize, in the fact that I'm dressed like this, I just got done exercising. So an hour, 2.5 hours a week of moderate intensity exercise significantly decreases incidence of heart disease, stroke, and death. And moderate intensity exercise is simple activities such as walking till you get short of breath. So one of the main things we can do is just get out there and do something.
So what happens if it runs in your family, you're living a healthy lifestyle? Should you still be worried or go get that checked?
Yes, it's important. So one of the things we can do, either as cardiologists or primary care physicians, is look at your overall risk profile and potentially lower you to normal numbers and therefore normal risks. So for those who have significant family histories, there's likely a benefit of lowering your cholesterol even lower than you can on your own. So it's very important, if you have a strong family history, to get checked either by your primary care physician or directly by a cardiologist.
Is there anything else we should know about cardiovascular health?
This is not a death sentence. So if we're at risk, there are so many things we can do now in 2023 to modify our risk. So again, it's important to adopt a healthier lifestyle, seek care of a physician, and hopefully that will significantly improve our longevity.
All right, all good things to know. Dr. Mehta, thank you so much for joining us today.